Hi guys, Dr. Scott Weiss again, here to talk about when to get a total knee replacement. Getting a total knee replacement is a huge decision. You're replacing your God-given knee with essentially a metal knee with plastic in between the metal, and there's no turning back once you make that decision. So you want to make sure you make the right decision. I think total knee replacements have helped many people, and certainly there are plenty of situations where they're indicated. So you want to make sure that you have the right indications for a knee replacement when you go ahead with that decision. By far the most important reason to get a knee replacement is your symptoms. If you have significant pain when you walk and you have to stop every couple of blocks because of significant pain, then those symptoms would warrant a knee replacement, and this is assuming that you have the degree of arthritis that warrants a knee replacement, where the bones are essentially touching each other. So if this is one bone and this is another bone, and the bones are essentially touching each other, that would warrant a knee replacement. There are different levels of bone-on-bone arthritis. Sometimes just a little bit of usually what we call the medial compartment of the knee is touching each other. Sometimes the entire medial compartment is basically collapsed on itself and touching each other. Sometimes both the medial and lateral compartments are touching each other. And sometimes just the lateral compartment has part or all of it touching each other. So there's different degrees of osteoarthritis. And what that means essentially is that you wore out all the cartilage between those two bones. It also means you tore the meniscus, which is a horseshoe kind of ring of cartilage that sits between the two bones, and you wore that out as well. Otherwise there would be something in between those two bones. Now, just because you have bone-on-bone arthritis doesn't mean you need a knee replacement. There are plenty of people that walk around with bone-on-bone arthritis and they feel fine. I actually had a high-level competitive marathon runner coming in to my office complaining of pain in one knee, and actually x-rays of the other knee, which he wasn't complaining of, actually showed bone-on-bone arthritis. So he was running marathons with bone-on-bone arthritis, and he wasn't complaining about that knee. So there's more to the equation than what you see on x-ray. Essentially that is inflammation. So if you have an inflamed, painful knee, you may not even have bone-on-bone arthritis, and you may have a lot of pain in the knee. So it's not such a black and white equation. Before anyone really seriously considers getting a knee replacement, I think you should really exhaust all other options. Simple thing to do is physical therapy. If you're overweight, try to lose weight. Exercising in a pool is really helpful. Supplements like fish oil and turmeric, I find, are also very helpful for pain and inflammation in the joints. Just be careful, those can make you bleed more, so stop it a week before any injection or surgery, and you can talk to your doctor before starting those supplements. Obviously, people try anti-inflammatory medications, Tylenol, and various injection therapy, whether it's cortisone, which can help pain and inflammation but may be short-lived and may, in fact, worsen osteoarthritis in the knee, especially if it's mixed with a lot of lidocaine, which also has been shown to be toxic to the cartilage in the knee. Other injections, which are my preference, are what we call viscosupplementation, which is essentially hyaluronic acid, which mimics the natural oil in the knee. And that's a series of injections usually, although it does come in a single injection as well. Those may actually be protective for the cartilage, and those also help with inflammation and pain. The biologics have started to take hold in the orthopedic world, especially platelet-rich plasma, and a specific kind of platelet-rich plasma called granulocyte poor platelet-rich plasma, although I think the literature is controversial about that as well. But regardless, platelet-rich plasma, or PRP, has been quite helpful for knee osteoarthritis. Essentially, you concentrate someone's platelets and you inject that into the knee joint, which has been shown to be also quite helpful for knee osteoarthritis. In fact, it may even be better than the viscosupplementation or the hyaluronic acid injections. Also, there are other injections called stem cell injections, in which you can take bone marrow or you can take fat, and you can use that to inject in the joints as well. And anecdotally, I've heard very good results with those as well, although I think the literature is still somewhat controversial about that as well. Those are certainly a little bit more invasive. You have to harvest fat, or you have to obviously harvest bone marrow, which is much harder to do than simply drawing blood and getting platelet-rich plasma. So my suggestion is I would start off with platelet-rich plasma. The downside is it usually will cost you some money because it's not covered by insurance. And if that helps, but not completely, I would try it again, perhaps 3 or 4 weeks after the first shot. And if that helps you more, but you still feel like you have some pain, you can try it even again and do 3 shots over a period of 2 or 3 months, and see how you do with that. If that helped you, but you still want to try something even more, and you're willing to spend several $1,000s, then you can try the stem cell injections, such as Lipigems is one company that makes a fat cell aspirate kit that's actually FDA approved. Terumo also makes a lipoaspirate kit that you can use, and you can inject that in the knee joint. And in fact, the platelet-rich plasma injection in the knee may kind of prep or prime the knee for the stem cell injection that you're getting subsequently. If the stem cell injection doesn't work, I'm not sure exactly when you would consider repeating it. I would say maybe 3 to 6 months after and see. But again, I don't think there's really any consensus on when to repeat it. Certainly before doing platelet-rich plasma, you can try, again, the cortisone or viscosupplementation. The only caveat with cortisone is that it could kind of work against all these biologic injections, such as platelet-rich plasma and stem cell injections. So again, my feeling is before getting a knee replacement, you should try to exhaust all kinds of therapy, weight loss, exercising in a pool, walking in a pool is very helpful. Just building the muscles around the knee joint can help with pain in the knee, even though, again, you're not going to change the actual amount of arthritis in the knee. And supplements like turmeric, fish oil, and all different kinds of injection therapy you can try before getting a knee replacement. And you want to make sure you go to a surgeon that has a really good track record, because there's really, you only got one shot at this. If it's not put in correctly initially, then you're talking a very complicated surgery afterwards to revise that. In fact, most surgeons will try to avoid any kind of revision because it's a very difficult surgery and the results are not nearly as predictable as doing the initial knee replacement. Some disadvantages of knee replacement, obviously, is that now you have a metal knee in your body with basically a form of plastic spacer between the two components of the knee. That plastic spacer can wear out over time. Also, having metal within your body, we're not sure how healthy that is for you also. And one of the major problems with knee replacements is that they can get loose over time, especially if you're overweight. So if that happens, then you're also talking a revision surgery, which could be quite complicated. Another disadvantage is they can get infected. If you get an infected joint that's an artificial joint, then it's a real complicated, kind of drawn-out process that you have to go through to get rid of the infection and then replace the actual prosthesis. So, in my opinion, there's nothing good as what you were given when you were born. We should try every effort to maintain what we have. There is a lot of ability for the body to regenerate itself. The body has an enormous amount of potential to cope and adapt to whatever condition it has, whether it's a bone-on-bone knee, where if you can control inflammation and build the musculature around the joint, most of your pain may go away, even though, again, you're not changing the amount of arthritis within your knee. And certainly science is really working hard to try to rebuild cartilage in the knee. We've done a pretty good job of that for trying to regenerate or regrow cartilage for focal chondral lesions or focal patchy arthritis, where there are different techniques that the orthopedic world has come up with to try to essentially fill in those patches of arthritis on the knee, and been quite successful actually. But when you're talking about diffused bony arthritis in the knee, that's a different story. And Still, I think the standard of therapy is total knee replacement, and there certainly is a role for it, and I think it's done a lot of good in the world, but you want to make sure that you're the right candidate for that. You want to make sure you choose the right surgeon, and you want to make sure that you really tried everything you can prior to the knee replacement, because again, there's no guarantee that your knee replacement is going to yield the result you want. As some people, unfortunately, have a real hard time. They have a stiff knee after the knee replacement where they can't bend the knee beyond, let's say, 95 degrees or 90 degrees. And, that's not an ideal result. So just some thoughts about knee replacement. This is Dr. Scott Adam Weiss from Probe Sports Medicine in Boynton Beach, Florida. Feel free to reach out to me if you have any questions. And you can email me at scottadamweiss@gmail.com and be happy to answer any questions you may have regarding whether or not to get a total knee replacement or in sports medicine in general. Take care.